Hi, I'm Samantha,
And I'm Elena.
and we are going to be discussing Down syndrome and how it affects dental health and treatment from a dental hygiene perspective. First off, what is Down syndrome?
Down syndrome, also known as trisomy 21, is a genetic disorder resulting from an extra chromosome number 21. This condition statistically occurs in 1 out of 800 to 1,000 live births, making it one of the most common genetic causes of developmental delays. It is important for the dental healthcare professional to be knowledgeable about Down syndrome so they can provide the best possible care to patients with this condition. So what are some frequent oral findings in patients with Down syndrome?
Fissure tongue, macroglossia, premature loss of teeth, especially the mandibular central incisors, narrow vaulted palate, mouth breathing, poor oral hygiene, bruxism, and xerostomia. Dental anomalies include delay or irregular sequence of eruption, congenitally missing teeth, irregularities, and tooth formation such as hypoplastic enamel, microdontia, fused teeth, class 3 malocclusion, and posterior crossbite are common and relate to the flattened facial presentation and underdevelopment of the mid-facial region in those with Down syndrome. Children and young adults with Down syndrome have a lower prevalence of dental caries, which can be attributed to delayed eruption, congenitally missing teeth, and microdontia that may result in wider inner dental spaces, reducing food accumulation. However, adults with Down syndrome have a higher incidence of dental caries, often due to prolonged xerostomia and poor food choices. Compromised immune systems in those with Down syndrome can lead to higher incidence of infections and delayed healing time. Oral candidiasis, nectarizing ulcerative gingivitis, aphthous ulcers, and periodontal disease are common and should be treated accordingly.
Some common cognitive and behavioral characteristics of Down syndrome include short attention span, impulsive behavior, slow learning, delayed development milestones such as language and speech development, reduced short-term working memory capacity, and poor long-term detail-oriented memory. Difficulty processing information that is delayed verbally, difficulty learning and implementing new skills, meaning they may not be able to repeat them at a later time, difficulty with nonverbal reasoning with a tendency to solve problems using verbal reasoning, and the patient may have difficulty with complex sentences. It is common for individuals with Down syndrome to have additional health concerns, including cardiac issues, high blood pressure, diabetes, neurologic conditions, gastrointestinal disturbances, vision problems, hearing loss, and increased seizure risk. So what are some things to consider when treating a patient with Down syndrome?
It is important to note that Down syndrome ranges in severity, and because of this, patient's care will be individualized. First, find out as much as you can about your patient's health and abilities using a professional and respectful approach. Their care will often involve a caregiver or other healthcare professionals. Always be sure to determine who can legally give informed consent for treatment. When treating a patient with Down syndrome, the dental hygienist should consider using a panoramic radiograph to determine whether their teeth are congenitally missing, as this instance is very common. Also consider scheduling shorter appointments early in the day due to the patient's limited attention span. Incorporate visual tools such as a typodont when giving oral hygiene instruction due to the patient's memory limitations and tendency for slow learning. When speaking to the patient with Down syndrome, eliminate background noise and speak clearly and concisely using terminology that is easy to understand. Explain the procedures that you will perform and what they will expect in terms of sounds and sensations. Additionally, it can be helpful to show them the equipment you will be using. Airway obstruction is common in those with Down syndrome due to airway abnormalities, so having the patient sit in a semi-fowler position will allow for improved respiration. Periodontal disease is the most significant oral health finding in people with Down syndrome, so include educational topics that will help benefit the patient's overall oral health.
Some of the educational topics to discuss with your patient will include encouraging independence in daily oral hygiene. Ask patients to demonstrate how they brush and floss and give recommendations on brushing technique and floss adaptations. Involve the patient's caregiver in this discussion if applicable. Sometimes the patient will have an occupational therapist to assist them in implementing tools for their day-to-day routine, and this can be a good collaborative resource for the dental healthcare professionals to ensure the patient continues proper home care after leaving the office. To simplify oral care, recommend a power toothbrush and an electric water flosser to help the patient with sufficient biofilm removal. Proxy brushes can be useful for the wider interproximal spaces common in the dentition of those with Down syndrome.
Nutritional counseling should be implemented. Cariogenic foods and beverages should be limited to prevent caries formation. Additionally, a nutritious diet will promote a healthy periodontium and better systemic overall health.
An antimicrobial rinse should be recommended to reduce bacteria and aid in the prevention of periodontal disease. Consider alternating with a fluoride rinse to address caries susceptibility due to the xerostomia that is common with Down syndrome. Be sure to recommend an appropriate delivery method based on the patient's ability.
Thank you so much for watching today, and we hope these tips assist you as a dental hygienist to provide remarkable dental care to your patients with Down syndrome.